glad to talk about our study, a potential of early detection of small brain mets with an automated lesion detection algorithm. So this study is sponsored by BrainLab and also provided as a beta test version integrated into a BrainLab element system. So the automatic lesion detection algorithm will delineate multiple cranial tumors based on the 3D T1 contrast-enhanced MRI scans. So we have 42 patients retrospectively selected. They are all multi-courses brain mets treated in our institution from 2020 to 2022, and study is approved by institutional IRB. And only the course 1 MRIs was used for the auto lesion detection algorithm to work. And the follow-up MRIs and the follow-up treatment courses were used to evaluate the newly found objects by the ALD from course 1. So the new found objects by the automatic lesion detection were reviewed and categorized into 2 groups, one compared against the follow-up MRIs. They are either stable or disappeared signal on follow-up MRIs, which means they are not a true brain metastases, or they grew in size on follow-up MRIs and was then actually treated as a brain mets on the follow-up treatment courses. As you see on the left panel is an MRI and with a metastasis circled in the yellow and also on the in the color of green. So the initial course was on June 2020, and the follow-up MRI was in September 2020. So the metastasis was 0.05 cc, and it was actually missed from the initial MRI on the left. In 3 months, it grew to 1.43 cc on follow-up MRI, and then was identified and treated on 3 months. But the original lesion was detected by the algorithm on the original MRI. And this is another example. On the left side is a small metastasis in the magenta color. It was only 0.01 cc, and it was not identified on initial MRI. And it is enlarged to 0.15 cc and was identified on 14 months follow-up MRI and was then treated. Again, the original signal was detected by the automatic lesion detection algorithm on the original MRI. And this is another example. On the left side is the original MRI. A small metastasis was 0.01 cc, and it was not identified on the initial MRI. And on the 6 weeks follow-up, it was enlarged to 0.5 cc and was identified and treated at that time. Again, this small signal was picked up by the automatic lesion detection algorithm on the original MRIs. And this is a panel of 6 pictures that are examples of the auto-detected lesion that were not a brain mets. And it could be either a stable signal meningiomas or small blood vessels, or just a small hyper-intensity MRI signal noises. They are either stable or disappeared on follow-up MRIs and was not treated on follow-up courses. So if we look at the total results of the 42 patients, so in this picture, on the left side, if we look at the horizontal oval, we have 225 clinical identified mets. And in the vertical oval, we have 236 identified objects by the automatic lesion detection. And they have 203 matching. And after the review on follow-up MRIs, 18 of them are identified on follow-up MRIs and then treated as brain mets. And 15 of them are stable or disappeared on follow-up MRIs. So in these numbers, the yellow shaded numbers are considered as true mets, either clinical identified mets or is identified on follow-up MRIs and treated, so it's considered a true mets. So the total true mets adds up together is 243. And if we use these 243 as a reference and compare to the 236 identified by the automatic software, we can see on the right side, the two ovals, the true positive have 221. So the sensitivity of the algorithm is 91%. And we have 15 false positive. And we have 22 clinical identified mets was actually missed by the automatic detection. So in conclusions, identifying very small brain mets is challenging, particularly when MRI quality is suboptimal. The introduction of the automatic lesion detection algorithm could potentially improve the sensitivity of identifying small lesions, thereby improving the treatment outcomes. And incorporating an automatic lesion detection algorithm may also enhance clinical efficiency by minimizing or avoiding user errors or variations. And this may also translate into improved clinical outcomes.